President Obama has made overhauling the healthcare industry a top priority. Over the weekend, the president said changes need to be made now.
When it comes to the cost of healthcare, this much is clear. The status quo is unsustainable for families, businesses, and government. America spends nearly 50% more per person on healthcare than any other country. Healthcare premiums have doubled over the last decade. Deductibles and out-of-pocket costs have skyrocketed, and many with pre-existing conditions are denied coverage. More and more Americans are being priced out of the care they need.
To help pay for his health care plan, President Obama is proposing reducing the government's medical spending and possibly cutting more than $300 billion from Medicare and Medicaid in the next 10 years. And the president is making a strong sales pitch for health care reform, but it's also fueling the fire of his critics. Insurance broker Craig Gussin joins us this morning to discuss the escalating health care debate. Good morning to you.
Good morning, Bridget.
All right, we just talked about the fact that he is speaking to the American Medical Association today. How critical is that speech for his agenda?
For his agenda, it's really critical because what he needs to do is get the physicians on his side. Right now, they're not on his side at all. What the president wants to do is have all physicians have to be in the government plan. And by doing that, that means that all physicians are going to take a cut in pay of probably 50 to 60% for everything they do.
Right, and they're probably not likely to agree to that.
They're not going to, and if they have to do it, let's say it gets passed, that means that what they're going to do, instead of charging, they're going to increase the cost to people who pay cash or to everybody else who has insurance to make up for it.
Your customers and your agencies.
And everybody.
Overall, how do the insurance companies feel about the possibility that there will be some sort of government plan in addition to private plans?
The biggest concern is going to be that we want a level playing field. For insurance companies, what happens is under the government plan, the government's going to be able to subsidize it. And on top of that, they're going to, like we just talked about, force the physicians in hospitals and everybody else to charge us money to them.
But isn't it good for patients, for people that are looking for health care coverage that don't have health care coverage right now? Some estimated 47 million Americans do not have health care coverage. Wouldn't it be beneficial to that group?
It would for the next couple of years. But after a couple of years, what's going to happen is, because the private industry can't compete, because it's an unlevel playing field, you're going to see insurance, most people are going to go to the government plan. And in 3 to 4 years, the cost of the government plan are going to skyrocket. And doctors and hospitals are going to say, forget it, we can't afford this anymore. We're going to charge more, and it's going to increase rates way beyond where they're at today.
So basically what you say will happen is that because this is a public plan, they have a more powerful buying opportunity, so they can offer bigger discounts because they're forcing the doctors into these plans. And insurance agents and agencies and health insurance companies are concerned that eventually that's going to basically push out all private coverage.
Yes, and we're going to end up with a government plan because it's the only one there, and then they're going to keep raising rates, and then people are going to say, we want a single payer, one plan for everybody. And the other problem with the government plan is that they're going to define what you have to take. And you may say, I'm really healthy, and maybe you're a guy and you don't need maternity coverage. Well, they're going to force you to buy maternity coverage. They're going to force you to get benefits you don't really want, and that's going to make you pay more money.
What about this taxing health benefits for employees? Right now, a lot of employees get health benefits through their companies, and they're talking about taxing those health benefits. How would that affect people who are paying into that right now?
That is probably one of the biggest issues, and why when Senator McCain was running for president and announced it, President Obama was so against it. Because what it does, it's a double whammy. I'm an employer. As an employer, I end up having to pay FICA and workman's comp on that money. As an employee, you're going to pay tax on it. So both sides get it. And what happens is all these years, employees have always gotten this, what I call free benefit. But it's not free. It's part of your pay scale.
Right.
But the benefit of it has been that people can afford health insurance. Because now you're going to have you can have less of a take-home pay. So actually, what they're going to do is defeat it because people are going to have less money to live on. And he keeps on saying, well, how the president does it, says, well, we're going to end up saving money based on other things. And you can say that, but there's no proof behind it except what they project.
Right. I guess they're saying that based on the Medicare and Medi-Cal payments, and they say basically that is going to pretty much consume the federal government's budget, a large portion of that. And they're saying this would go ahead and bring that down. So in the long term, they say the plan is going to be more effective and save people money and save the government money.
But if we've looked at the past history of the government, you look at the stimulus package and anything before that, it's everything. Every time they make a projection, it's never right. It hasn't been right. It won't be this right. And the worst case for this situation is that we're dealing with everybody in the United States health insurance and the health care. And if it doesn't work, it's going to make today's situation look unbelievable compared to what we're going to have in line in the future. And that's a concern that I think everybody has. That's why all the Republicans are against it, the American Medical Association is against it, the Chamber's against it. Almost everybody's against this because they see it sounds great on paper, but it's not in the real world. Yeah,
but with so many Americans in need right now and out of work, it sounds like a pretty good proposal to them.
To them, but when you really, you know, Dan and I talked about this the other day, but when you analyze that we have 47 million people uninsured and 1/3 of kids who have healthy families, you know, so that's 16 million. You have another 16 million of incomes making, you know, family incomes of 50,000 or more, and another 9 million of kids 25 to 35 who choose not to have it. We bring it down to about 9 million people. 3% of the population really are the people we need to help.
Insurance broker Craig Gussin, thank you so much for
My
coming
pleasure.
in. Great to talk with you. It's going to be a hot topic throughout the summer. Thank you.